So we've got Sophie coming next. Sophie works with me in health influencing in my Age UK part of my job, and she leads the winter campaign. And this year, it's more than ever going to be so important that we make sure that older people, are winter ready. And we'll have on our website, on the MTF website, we'll put links to all the activities that are going on with Age UK so that you can get the information easily. So, Sophie, over to you. Thank you.
Perfect. Thank you so much, Leslie. Yes, hello everybody. I'm Sophie and I work in the health influencing team with Leslie, as she's just said, at Age UK. And today I'm going to be talking all about winter resilience and how we can support older people to be winter ready. So we know that winter is a very challenging time for older people. Cold weather, winter viruses, decreased socialisation and movement all contribute to adverse physical and mental health in older people, which unfortunately can lead to hospital admission and in some cases serious illness or even death. We know that once in hospital, older people living with frailty and or multiple health conditions are more likely to have longer stays and require additional support on discharge. And although we know that every winter can be a challenging time for older people, the last few winters have been particularly tough, and it's very likely that this winter will be equally as hard, if not more so. So, whilst we know that winter is hard and it can be hard for people of all ages, it's often helpful to understand exactly why older people find it especially challenging. So, there's lots of reasons for that. But firstly, we know that many older people live with long term health conditions such as arthritis, asthma, COPD, and these can be harder to manage during the cold months. This is because the cold weather has an impact on both the condition itself, making the symptoms more severe, but also because older people find it harder to manage their conditions because they find it harder to get out and engage in physical activity. Temperature, we know that older people are generally less able to regulate their temperature, and frequent exposure to cold temperatures can have severe impacts on older people's health, which is why strokes and heart attacks are more common in the winter months due to the impact on the heart and circulatory system. Falls, we know that there's increased risk of falls in the winter months due to slippery and icy surfaces, but also because older people are moving about a lot less, which causes some physical deconditioning and impacts that muscle strength and balance. Loneliness is obviously an issue that's found all year round, but can be particularly pertinent in the winter months when people tend to stay at home a lot more and socialise less, which has a huge impact on physical and mental health and nutrition. And finally, respiratory diseases. We know that common diseases such as flu, COVID, RSV are more prevalent in the winter months when they have a surge of cases, and older people are more susceptible to the severe impacts of these conditions. So, having gone over in the last slide a few things which impact older people every winter, I want to focus on some specifics for this winter and why we might be particularly concerned this year. So, firstly, the cost of living is still very much around and has real implications for older people who are generally unable to increase their income or are starting on a very low income. Older people, as I've already mentioned, spend much more time in their homes, and so they feel the cold more, which has real implications for heating costs and finding the finances to stay warm. And unfortunately, we have heard from so many older people who are already and will continue to make sacrifices between having their heating on and other necessities such as food, which, for all the reasons we've mentioned today, is particularly dangerous. This year, unfortunately, there are also changes to the eligibility for the winter fuel payment. So, means testing this payment means many older people who are already missing out on benefits such as pension credit will now also miss out on the winter fuel payment, putting an additional strain on their finances. We know that each year so many benefits go unclaimed by older people who are entitled to them, and we have already heard from so many older people about how concerned they are about potentially losing this payment and the impact it will have on them this winter. And it's important to remember that actually a lot of people that are losing out on the payment are on or just above the poverty line, so are in a very vulnerable position. And finally, we're all greatly aware of the strain that the health and social care system is under, and there are always concerns that older people may not be able to get the care and support that they need when they need it, despite the huge efforts of the health and care workforce. So the challenges I've just spoken to are reflected here in some Age UK representative polling research, which was undertaken last winter. And we have undertaken this research again this year and actually estimate these numbers to be even higher We hope to share those results soon. But particularly worrying here is just the amount of older people who are worried that they won't be able to eat enough or stay warm this winter, which we know will have huge consequences on their health and well-being. So we also undertake a survey to accompany that polling shown in the previous slide, and this really gives us an idea of how older people are really feeling in their own words heading into winter season. And here are just a few quotes from over 30,000 responses we received to the survey undertaken this year. And again, like the polling, we're hoping to share those results with you all soon. These hard-hitting quotes give us an insight into what winter can really mean for older people and the very real circumstances they're facing. So I won't read them all out, but as an example, last year I froze when it got cold and reluctantly put the heating on. This year I can't even do that. I can't even remember thinking last year. I can even remember thinking last year I can't go through another winter like this. So really horrible to read and hear about the challenges that older people will be facing. So what can we actually do to help support older people this winter? Our main aim for the winter should be to keep older people out of hospital by ensuring they are supported and educated on the key messages, including the best ways to obviously stay warm, keep hydrated and eat well, have a winter ready and foolproof home, keep moving, look after their mental health, get vaccinated, and access all the financial benefits that they are entitled to and that we know so many older people do not claim, which again will be particularly important this year. So each year, Age UK runs a national winter health campaign, which reflects those key messages I just spoke to and involves various elements, including sending out winter information packs and resources, cascading cold weather alerts, sending communications out through our website, media and social media channels, partnering with organisations such as UK Health Security Agency and NHS England on resources such as our Keep Well This Winter leaflets, supporting our local Age UKs to run support services for older people. And then we also have our information and advice line, which you can call for advice on a range of topics, including benefits or financial concerns. And we also have other services such as our telephone friending. So on the screen, you'll see an example of some of those winter resources I just spoke about. Got our top tips postcard there. In the middle is the poster, and then our leaflet with UK Health Security Agency and NHS England on the end. And these are sent out to 268 HK retail shops and 124 local partners and volunteer leads. These are particularly helpful because it obviously ensures that these important messages are getting out into local communities and through channels which our local HKs know older people will engage with. And obviously they're also printed, so are in physical copy, helping those who are digitally excluded. Our joint leaflet with UK Health Security Agency and NHS England goes out to all those who receive the warm home discount. And then we have other resources such as our winter wrapped up guide and other INA resources, which can be downloaded or ordered by anybody in the public or professionals. So we also have a new, it's been around for about a year now, but a relatively new professional hub up on our website and a monthly newsletter, which some of you may be interested in. You can sign up and get the latest resources and advice on how to support older people this winter. The hub includes a coordinated response to winter pressures guide, which is aimed at starting conversations between the system and those delivering services to help support older people this winter. And the newsletter covers new topics each month. And that is it. So thank you for listening. Obviously, if there's any questions, then I'm happy to answer them.
Thank you. I think that was great. And I think it's really worrying. We are concerned in Age UK about winter this year. And we've been doing our survey now for a while. And I think it's fair to say that the quotes and the stories that we get from older people who complete this survey is getting worse. And so many older people are feeling really desperate, and quite a few of them don't have people to call on. So in this week, when we're thinking about nutrition and hydration and all things older people, I think we all need to make a pledge to ourselves to keep an eye open for older people in our community and make sure that they're okay for winter, that they're wrapped up, that they've got food to eat, and that they're not too lonely. So that would be my message. I'm sure that's your message too, Sophie.
Absolutely.
So thank you for that. That was really interesting. Well done.
Thank you.